So getting to a more complex assessment, I did want to talk briefly about the Ottawa Self-Injury Inventory. And I believe you have the shorter version of that in your handout. Is that correct? The OSI F for functions. This is also available on the website, on the professionals page that I was talking to you about. And this is an instrument that was developed in conjunction with myself and Paula Cloutier, who's a research associate at the Children's Hospital of Eastern Ontario in Ottawa. And what we've been using now for some time. And I'm very delighted because it seems that a number of people are interested in using this from the perspective of research, and it's been translated into a number of different languages because this problem is just not in North America, that's for sure. We're currently working on a study in terms of validating this instrument, and I apologize, I don't have any information that I can present to you on this at this time. But I did want to go over it briefly with you. And really what we're looking for in this case is a more detailed series of questions and answers around the behavior, more specifics around the frequency, the types, the functions. Because of the repetitive aspects of a lot of the youth that we treat, we're looking at the potential for addictive aspects, because it's our sense that the approach and expectations in these youth has to be reasonable. And we also are evaluating, in a very simple Likert scale, their motivation for change. So this might help us determine whether a youth might need a psychiatric evaluation if a lot of their responses are in terms of suicide behavior, in terms of coping with depression, things like that. And whether these might be also suited youth to the dialectical behavioral therapy approach. How many people are familiar with DBT here in the group? Okay, because we will be talking, Harjit will be talking a lot more about that shortly. And depending on what else we might find out, there might be other interventions recommended, including family therapy. So the first page looks like this. And basically what we're interested in is not just the self-harm behavior, but not just the acts, but also the urges. We think the urges to self-harm are equally important in terms of how frequently they're experiencing and how they're coping with them. So we ask about both. And we describe the third urges as a thought. And we have 2 periods of rating in the past month and in the past 6 months. We also ask about thoughts of suicide in the past year. So you can go through this one in detail. The more lengthy one is on the website. The one you guys have has got the functions in it. The bottom section asks about locations for self-harm, and what we're interested in is if there's a 2-year period from when they start to when I'm seeing them, I'm interested to know when they first started, where they were self-injuring and where they're self-injuring currently. The section I want to point you to is the lower section here, which is the start of the functions questionnaire. And because we're studying this from the research perspective, there is this 0 to 4 rating scale. And our first question is around to release unbearable tension. And why did they first start? And you can see this youth, it was primarily a reason, but much more so as he continued to self-harm. So typically what I do when I have this filled out is I'm looking at anybody for like about a 2 and up. And I'm looking at what they did when they first started and what they're doing in terms of continuing. So in your questionnaire, you have the short version, and what you can do is kind of summarize in sort of scoring sheet what we have there, what type of functions it might primarily serve. So I'll just go through, because in the longer version, on the last page, we have this question around addictive aspects, which is worth looking at. And what we basically did was we took the DSM-4 questions around substance abuse and just substituted self-injury for substance. So the self-injury behavior occurs more often than intended. The severity in which the behavior occurs is increased. It's produced an effect when you started that you need to self-injure more frequently or with greater intensity, etc. So our experience is that the more frequently they've been self-injuring, the more addictive, and the more addictive the behavior is rated as. The expectations around change should be well within reason, and many of these kids need more than 12 sessions. In fact, we often offer them a second group to consolidate some of their gains. And we ask a question at the very end around whether there's anything else that we haven't asked them. So I'm going to stop there, and I'm going to pass over to Harjit to finish up the rest of the morning here.